I like to move around a little. I'm reminded of Paul Newman and Robert Redford and Butch Cassidy and the Sundance Kid. And Martin Struthers says, can you shoot to Redford and misses? And they say, what a mess. And he says, can I move when I do it? And he moves and he shoots pretty good. So if you don't mind, I'll pace a little bit and we'll see if I can move this podium away from just go back and forth like this. When my wife and I went to our first Compassionate Friends meeting, we sat in a circle with other bereaved parents, and I thought we were the only people who had ever lost a child. And I thought our story was about as bad as it could get. But through the genius of this organization, I was taught to understand the greater community. And one by one, bereaved parents told their story about their children. And I remember leaning over to my wife and saying, you know, these people are in bad shape. For a moment forgetting how in bad shape we were. And Lord knows we had something to feel bad about. Our son had come home from school with a pain, which we interpreted as something to do with him playing the guitar and using a phone at the same time. But to be on the safe side, we took him over to a doctor who suggested that it was a muscle pull, as we said, and then when it didn't go away, we went back to the doctor, and he suggested that maybe now it was a chest infection for which he received antibiotics. And then we went to the doctor again when that didn't work, and they took a chest x-ray. And there was a tumor the size of a grapefruit growing on these ribs. Ewing's is a disease more than often than not of puberty. It is a mistake in the DNA which kicks in during the change of life and causes uncontrolled bone growth. It happens in different parts of the body for different people. Matt had them growing out of his fifth and sixth rib. It's also a kind of an orphan disease, actually not unlike a lot of children's cancers. Not enough children get some of these diseases for drug companies to find it profitable to develop treatment for them. And as a consequence, oncologists are forced to cobble together treatments for diseases that are more well known because more research has been done, and sometimes to work with diseases of adults and try to modify it for the children's version. With Ewing's, roughly 200 people come down with the disease each year in the United States. So it's very difficult to know what to do. The initial idea was for there to be the standard chemotherapy, which had no effect whatsoever. And at that point, it was decided to try an experimental kind of chemotherapy, which required an ethics committee of a minister, a priest, a rabbi, a moral ethicist, and so on, to debate whether or not it would be all right to give this young man treatment that had never been tried before. And they agreed that it should be done. It was remarkably successful. In the first month, the tumor receded 50%. So we were really in good shape, we thought, except that Ewing's is a remarkably adaptive disease. And within 30 days, with continued use of the drug, the tumor had grown back. Still, there's information in there that's useful. At that point, the physician said that we were hoping to get the tumor smaller in order to perform surgery, but we don't see we have a choice. So Matt went in and had most of this rib cage removed. And I remember the day of the surgery because 2 hours into the surgery, my wife and I were waiting in the waiting room. Where else would you wait? And someone came out and said, the physicians need to see you. And the surgeons had walked out of the surgery and had asked us for a private meeting in which they said the cancer is far more advanced than we expected. And we have two choices, but we cannot make the choice ourselves. So we're going to ask you to do it, and you must make the choice now. This is the choice. We will sew him up without doing any further surgery, without removing the rib cage, and he will die in 3 months. But he will not have the other things that would have to be done if you want to go the other route. So what's the other choice? The other choice is because his bone marrow was not affected. The other choice was to have a bone marrow transplant after his rib cage was removed. And there was no guarantee that that would work, but it was the only chance he would have. And please decide right now. You know, in my novels, I don't think you would believe that scene. And we made the choice that I suspect everyone in the room would do, which was to opt for hope and to say, go ahead with the surgery and we'll try the bone marrow transplant. So the rib cage was removed, and actually he recovered pretty well from that. In fact, I remember the day before the bone marrow that he was eating lobster and steak, and we were saying, hey, you know, we got some good stuff going here. But the bone marrow transplant is a very, very difficult procedure because the theory is to give life-threatening amounts of chemotherapy to kill the cancer before the patient dies. Because certainly if you kept going, the patient would die. So he was given as much as the body could bear. His immune system was lowered to 0. His bone marrow was reintroduced, and he was then set to wait for the bone marrow to spread. The body is really an amazing thing when it works properly. For the bone marrow to spread and for him to get immunity back. Well, it didn't work out that way. Staph and strep germs that normally exist upon us and which we can handle easily multiplied out of control. He contracted septic shock and died from a heart attack. So, I'm going to skip ahead and then I'm going to go back. I'm telling you this graphic story because I'm trying to make a really bad case here, as most of you have bad cases. And then I'm going to try, the fact that I'm up here talking to you about this suggests that maybe I figured something out. And the goal, especially for the newly bereaved, is what's going to happen? Am I ever going to overcome this? Will I ever feel normal again? So I'm going to tell you a little bit more about the family. And I'm gradually going to lead into what I hope is something for you to hang on to. So I said, thank God that's over. That is the worst thing in the world that I ever experienced. Being in that kind of grief, as you know, is like being in the most severe shock you can possibly be in. It's as if you fell off a cliff and every bone in your body had broken and your body is just struggling to stay alive. And you're in such shock you don't even know you're in shock. And gradually, it took me 3 years before I became functional again. And gradually, as my life proceeded, never forgetting my son, he's with me every day, I said, thank God I don't have to go through that again. And then in 2008, my granddaughter, Natalie, who was 14, came home with a pain right here. Well, she'd been playing volleyball, so she must have an athletic injury. You see where this is going. Well, the athletic injury kept going, and now we have a little growth here. And I knew where this was going. Well, my daughter, of course, had lived through all this and seen it with us. Her name is Sari, but she was on her journey And I watched the disease progress. It was identified as Ewing sarcoma. Remember, only 200 people get this in the United States each year, and it is not believed to be inherited. I have talked repeatedly to oncologists about this. They said it is not inherited. They have no data to indicate this. So what are the odds of the same family getting the same disease when only 200 people get it in the country? This is unfathomable to me. And Natalie went through the same situation. But this time there was a variation, because the drug which Matt had found effective for 1 month had now, because of Matthew, become part of the standard arsenal, except that by trial and error it had been discovered that you needed to alternate, because the tumor got accustomed to the assault of the one drug. So if you alternate and give it a totally unlike one with equal severity, it might work. And it did work. Her tumor got small. Sound familiar? And she had radical surgery. Her entire hip was removed. The bones remained in the left part of the leg, but there was nothing to hang on to, although the surgeon was brilliant and was able to use piano wire so that he could have the muscles of this leg attached to the muscles up here, so that there was some limited use of her leg. But she needed to finish the chemotherapy. And as things progressed, guess what? As her immune system got lower, diseases that we normally wouldn't have any trouble with came into bear. And in this case, it's a disease called C. diff. And she became terribly sick with it. She really never recovered. The more chemotherapy, the more sick she got. She collapsed. She was put in a coma, and medically induced coma. On the respirator, she blew 3 holes in her lungs, and I had to talk to Sari and Andy. The physician said to them, she's never going to come out of it. And the dear parents were sitting there looking like they couldn't see the other side of the room. And I said to my daughter, I said, Sari, do you know what he's saying to you? And she said, I don't understand. And she would have under other circumstances. And I said, they're saying the machines need to be taken away, that she must die. And that's what happened. All right. I'm going to flash back now to what happened to me in my steps of recovery up to Natalie, and try to make some sense of it to you. And a lot of it you're going to recognize. The part that I immediately noticed was that all our friends ran away. Sound familiar? It's amazing how they're there and they say they will help you and they'll stick with you and all of that, and how they ran away. In Matt's case, even his godfather fled. It was like 6 months after Matt died, the godfather showed up at our house and he said, you know, I felt real bad not being there for you, but I didn't know what to say. Didn't know what to say. Because, of course, people, I call them civilians. We're all battle-hardened, right? Civilians. They think they have an obligation to tell us the secret of the universe. They want to tell us about how our children are in a better place. They want to tell us how that it's for the best, or the child isn't suffering anymore, or whatever stuff comes at us. My daughter, I remember my daughter's getting, she says she wants to leap across the table and start strangling people, But well-brought-up woman that she is, she bites her tongue. The foolishness that people, supposed adults, bring to this kind of conversation. Or someone earlier today I was talking, I wish I lived to credit everything, but I can't remember who said this. It someone was told, one of you was told, I know exactly what you're feeling. My cat died 6 months ago, and right? I'm sure some of you have had that too. Only someone who has gone through what we have gone through knows what this is about, and that the only thing that anybody can say to us is, I'm sorry, and to hold you and just say, I am sorry. And often people who have friends who have lost children come to me and say, what should I say? So interesting. How do you need to be taught that? And Compassionate Friends, the very name understands that. And I say, just tell them you're sorry. And one of the things that came out of that for me is, I remember my wife and I used to take long walks every day. One of the things we pledged to one another is that we had seen so much pain, and we were in so much pain, is that we would never knowingly hurt one another. And 21 years later, 24 years later, we are still, God, I can't even add, 87, what is that? God, you got me also flustered. Years have passed. And we were, we'd be walking, and there was a kind of a peace in just being able to move and to be kind to one another. And I felt that, my wife once said to me, David, do you think there's a heaven? And I said, I don't know. But I know this much, if there's a heaven, our son is all right. If there isn't a heaven, he's all right, because he's not in any pain anymore. And I found that as we worked through this, and as we began to think about the concept of I'm sorry and helping one another, and helped other people, because on this one walk I'm referring to, I had this vision that in every house that we passed, eventually there would be the kind of pain that we had gone through. This is undeniable. It is the way of the world. Eventually, it will happen in every house. And I had this vision of a world of pain. And what do we do about it? And I had this further vision that from now on, in memory of my son, that I would vow to exhibit as much good nature as I could to everyone I came across, because I could not possibly know the inner pain that they might be feeling. And the Compassionate Friends is something that we learned this from. I found that if God, it's so hard to talk about these things, that if I went out of my way to be kind to people in my son's name, that somehow my son was living through me, because I had dedicated my life to be what he would have wanted. This struck me as so powerful a thought that it was able to sustain me even when the panic attacks started. And not a lot of people talk about panic attacks. I was glad to see that there was a session today about them. Just before Matt died, I began to have certainty that I was having a heart attack. The pain in my chest was just terrible, except that simultaneously my head was spinning. So I couldn't tell if I was having a heart attack or a stroke. But what I did know was that after I collapsed, they were taking me to the emergency room. So, we've got my son in, and, we're having a lot of fun in that hospital. And I went in and I said, I'm having a heart attack. And he said, not talking that fast, you aren't. Does this sound familiar to you? numbness in your hands and feet, numbness around your lips, I can't even speak, pressure in your chest, sense of swirling. Go and look at yourself in the mirror, you got eyes as big as the moon, except that they're dark. Boy, you look like you're on drugs. Bad eyes. And a whole sequence of other symptoms which debilitated me. I remember vividly having a panic attack. I was on a sofa in my house, and we got a call. I picked up the phone. Matt had just died like 3 weeks earlier, and I got the phone. He says, "Is this David Morrell?" "Yes." "Well, I'm so-and-so with the IRS." And I said, "Oh, really?" He said, "Yes, we've decided to give you a full-scale field audit. That's 3 days, and the accountant has to be there and all that stuff." And I started to laugh. And he says, "Sir, the IRS is not accustomed to being laughed at." Well, I bet it isn't. And I said, "Well, here's the deal. My son died 3 weeks ago. I'm having a panic attack. And honestly, I don't care about the IRS." And I eventually wound up going to a psychiatrist. I was not because of the IRS, although God knows they have driven many to psychiatry. No, I used to have 5 to 10 panic attacks a day. And I'm not talking anxiety attacks. I'm talking the full-blown where your heart thinks it's going to push right out of your chest, where the room was swirling and everything felt like 100 miles away. Some of you are nodding. You know what I'm talking about. And it was so difficult. I mean, if we were talking about, learning how to care about people and try to lead a good-natured life and be good to others in our son's name, at the same time, I'm fighting this terrible, terrible physical disease. And I mention it at length and graphically because some people, for whatever reason, choose not to get help. And here I'm a best-selling novelist, and I said, "I've got to go to a psychiatrist." And it was interesting when I went because he said, "I have an ethical problem because I assume that anybody's a writer," and he knew what I was doing and that I created Rambo, and he said, "You already have so many mental problems." This is true. "You already have so many mental problems. I have to be careful to work with you on your son's death and the panic attacks, but I don't want to put you out of business." So he and I worked for, I would say a year and a half, and thus began the great adventure of Xanax. So we started with the pink, and then we went to, first we were breaking them in half. No, the whites first, right? Then we went to the pink, then we went to the purple. And those of you who laugh because you know what I'm talking about, trying to get off that baby, boy, isn't that a lot of fun? Because as you dial down, you get into rebound situations. Struggling with all of that, trying to figure out where are these panic attacks coming from. Yes, my son died, but something else was at work here. And this is what was at work. And this is my message to you. I'm losing my train of thought. Isn't that awful? My message, I forgot my message. Wow. All right, here's the message. I denied that Matt was dead. Oh, I knew he was dead. We had him cremated. I mean, I could see the urn, but I denied it. I truly believed in a woulda, coulda, shoulda situation, which I know everybody in this room, in one form or another, I don't care how your child or your grandchild or your sibling died, the coulda, woulda creeps in. If only this had happened and only that happened. And I truly believed when I went to bed at night and I prayed about this, I said, I know that if I concentrate hard enough in the morning, this will never have happened. Never happened. This is the worst dream I was ever in. This nightmare didn't happen. In fact, I have a book I wrote about all this called Fireflies. It's long on a print, it's an ebook now, and in it, I dramatize this kind of thinking. And I struggled, and I refused, and I fought, I resisted. It took me 3 years. And one day, I don't know what precipitated it. I remember vividly saying to myself, you know what? It really happened. And you have a choice at this point. You have a choice to let this control the rest of your life so that you would not lead the kind of life that your child would have wanted, or else you can accept the reality of what happened, and if not become happy, at least become functional. Functionality is a big thing with me. People say, well, when do you get over grief? You don't. I'm many, many, many years into this process, newly stabbed by my granddaughter's death. You don't. And anybody who says, Chuck, a policeman, I was on a panel with him. Where is Chuck? Is he here? There he is. Very interesting. The policeman that you spoke to, like in 6 months, it's time to get over it, right? Let's get on with it. It's done. What's the matter with you? Well, they've never experienced it. They have no idea what's going on. It is my view that the kind of profound grief that we have suffered changes you essentially. You will never be the same again. And if you cling to that, oh, it was so wonderful back then. If you cling to the regret, it will destroy you. I'm not saying forget. I swear to God that I feel Matt's presence and Natalie's presence with me now. I feel them with me every day. And in one memorable occasion in New York City when I had a panic attack at midnight, on a street where I had 31 blocks to walk because I couldn't find a cab, I swear that I felt the presence of my son holding me up and allowing me to walk. It took me 2 hours passing the worst people in the world to get to my hotel at 2 o'clock in the morning. I feel them profoundly with me, and do not misunderstand what I am saying to you. I'm saying that the need to become functional, to be valuable to society because of what has happened to you, is the critical decision you will eventually have to make. If you're newly in grief, I don't even expect you to think about this. You're in shock. The best you can do is get through each day and not collapse and be kind to one another. But as that first anniversary occurs, you find yourself in a position remembering back to the previous year. And as the next anniversary occurs, you find yourself remembering, and so on until a layer of scar tissue is built up. You don't forget, but it's different. And it's different because you have made the choice to become functional in your child's name. It's a profound task. And it's the only way I know to have moved forward. It's the only reason I'm able to stand up here and not sob as I tell you my story, because I think my truth, which I forgot, I think my truth is serious enough for me to be able to try to communicate it to you. Now, let me just say briefly about Natalie and the grandparent situation, because now I was in a different situation. I knew it was going to happen, and I was watching these poor parents go through what my wife and I had gone through in 1987. Now, you want to talk about mind games, and you know, your mind's like a trombone. You're going in and out, in and out, in and out like that. And the heartbreak I felt as Natalie died, I was there holding her foot when they took the machines away. The heartbreak I felt for the parents, and I remember going over to Sarah and Andy and saying, I am so sorry for you. And what I couldn't say was, because I know the pain, and I grieve for Natalie, I grieve for my daughter and her husband. A wholly different kind of grief, which in some ways is perhaps not talked enough about with grandparents, but those of you who are in the room know what I'm talking about. And in our case, fortunately, we have a good relationship with our daughter and son-in-law, so that we are able to try to provide guidance and counsel as best we can, which provides a kind of buffer, so that in some ways, because I'm busy with their emotions, I've been able somewhat to deal with mine. It's an immensely complicated situation, but you see the same theme. To be productive, to be functional in order to, I could easily collapse and say, what are we going to do? And Natalie's gone and all that heartbreak. But I have a daughter to worry about. I have a son-in-law to worry about. I have that truth that I talked to you about, that if we can become functional in the name of our lost loved ones, it gives our life purpose, even as we continue grieving. If you can stay with that, if you can consider it, then perhaps what my wife and I and my daughter and my son-in-law have been through can be of help to someone else. Thank you.